I'm Dr. Anthony Kaveh, and I recently had a patient that came to me saying, Doc, I cannot find a way out of my depression. I have tried everything, but nothing has worked. And this patient had been stuck for years, perseverative and ruminative loops of the past, which we call depression, brought upon by traumatic experiences from childhood. And I asked, when you say you've tried everything, do you mean you've tried other states of consciousness or everything within the same frame of consciousness? And they looked at me like I had two or three different heads and said, what are you talking about, doctor? And that's what I'm going to tell you about the 5 states of consciousness, one of which brought incredible healing to this particular patient in just a number of weeks after years of being stuck and not having any light at the end of the tunnel. Let's get started with number 1, and that's the one altered state of consciousness that everyone has experienced if you're watching me right now, and that's REM sleep. That's the stage of sleep when you have dreams. Now, this is really powerful because it sets the stage for the other 4 altered states of consciousness, none of which are as universally experienced. But you're going to see the theme across these 5, and they all base from what dreams can do for you in terms of their healing potential. But let's go to number 2, and that's the meditative state. Whether you're an amateur meditator or you've been up in the Himalayas and you've seen really, Jedi Zen-like, that's my favorite word, right? Jedi Zen-like monks who have achieved these deep states of meditation where their brain waves are actually changing based on where they're at. This can have profound changes in the body that we're going to talk about, and it's going to dovetail with the other states of consciousness. And these are going to be experienced in fewer people as we move along. But I'm going to share with you the thread of how they can help you heal in ways that SSRIs and other antidepressants or anti-anxiety medications rarely can address, especially not the root cause of. Since I'm in an operating room, number 3 is going to be anesthesia and what that does to your state of consciousness. That is fundamentally, when you put electrodes in the brain to actually examine what happens, the brain a completely different state of consciousness. It's actually not sleep, even though I tell patients every day that we're going to go to sleep in the operating room, like this real life operating room where we're doing surgeries in not too long ago. That altered state of consciousness is actually a medical coma. And now you're probably wondering, how on earth do you heal when you're in a coma? We'll get to that, but I got to finish with the other 2 states. The 4th state is the psychedelic experience, including ketamine. Not technically a psychedelic in some ways, but nonetheless, that brings about an altered state of consciousness that can provide profound healing, like the other states when used in a particular setting. And then number 5, I want to give you a shout out if you're there. This is live, of course, unscripted. I'm going to give you a shout out if you can even guess what the 5th altered state of consciousness is that I have seen perhaps some of the most profound healing occur through. I'm watching the comments. If you know, please let me know. And I really want to see what others. I see Linda already talking about LSD. Well, I already mentioned that. REM sleep, I mentioned that as well. Trance meditation, Bumblebee, I mentioned that one as well. Being positive, Raymond, is absolutely powerful. It's not necessarily one of the altered states of consciousness that I'm going to share with you. Mindfulness, Helios, we talked about that one already. And Linda, nothing to be sorry about. Your guess was very good and actually was correct. Out-of-body experience, says Linda. Well, in some ways, yes, but specifically, there is one type of experience that can be had that takes us into, I call it, a different state of consciousness. It's different than the other 4 I mentioned. Near-death experiences, well, we're getting kind of closer. Hypnotic states, we talked about the hypnosis of chemical induction like anesthesia and meditation. B for him mentions prayer. Absolutely. I kind of lump that in with the meditation one. I'm going to tell you, number 5 is the hardest one to grasp, but is one that perhaps has some of the most profound healing. And that is what happens to the brain in someone who has recovered from an addiction, whether it's a chemical addiction, shopping, gambling, sex, or if it's addiction to negative self-thoughts that keep us stuck for months or years. Once again, that stuckness, if it's of the past, we call it depression. Of the future, we call it anxiety. And when I have a patient who has recovered from that, and the withdrawals are very real, whether it's depression or whether it's fentanyl, that state of consciousness, when someone is actively struggling through the withdrawal of using something, bears resemblance with the other four. So what do these five have in common? REM sleep, meditative experiences, psychedelics, anesthesia, and the withdrawal state. All five of them combine three elements. One is the loss of control. Two is the incredible neuroplasticity that allows for self-discovery in ways typically never thought of before. And number three is the risk of harm. None of these come free. They all have a risk of harm. And that's why it's not just something to go and try ketamine. You need to do it in a safe experience. Same with LSD. Even in some deep meditative states, people can get lost. And as you know, I'm an anesthesiologist and an integrated medicine specialist. I have a ketamine clinic. And I'm very, very careful to make sure that when someone is struggling to heal, we support them through a ketamine experience to provide that self-discovery that comes about with the loss of control. That in the case of the patient I mentioned at the very beginning, transformed years of suffering within a matter of weeks. How is that possible? How do these three or these five altered states of consciousness change your brain in a way that no medication can? Well, before I share that, I just want to say that if you appreciate me coming in here after a long time in the operating room, I really appreciate if you hit that like button and share what you've learned with others. Your support helps me do this more often. And as you know, I do have my exclusive access for our private Zoom sessions where you can ask your questions privately of me. I will answer as many questions as I can in our public stream today, but in that private Zoom, we have a more personal setting and I can answer more of your questions. The link is below. Now, tell me, how can these five states of consciousness fundamentally heal us in ways that other pharmaceuticals can't? When we enter sleep, the dreamlike state, how much control do you have? When you're having a psychedelic trip, what happens to your control? Under anesthesia, your control. All five of these states are hallmarked by giving up control in some way, voluntarily, if you want them to be healing, typically. In the case of the addict, they need to begin their recovery stage by stopping using. No matter how much control that substance has had, part of this sometimes involves an acceptance of they've lost control over their body. Now, all five of these states involve giving up control, but what happens from the change in consciousness that happens when we enter the state willingly is that the brain can rapidly form new connections. We call this neuroplasticity. We can call it synaptogenesis, neurogenesis. They all refer to the same phenomena, and that is a rapid rate of learning that can help unlearn old habits. Whether it's ketamine, whether it's LSD, whether it's a deep meditative state, it's curious that when we give up control, we can actually gain new discoveries by virtue of exploring a new pathway. So when patients come to me severely depressed and there's no light over the horizon, even having a glimmer of an alternate way of seeing, which is what's afforded by any of these five experiences, can do what the SSRI fundamentally can't do. But I mentioned earlier that there's a risk that goes with this as well. What is the risk of learning something new about yourself? Maybe you think it's like, how could that go wrong? It sounds amazing. Well, the problem is that if one has an experience like this that's not guided, we have what's called the cautions of unearned wisdom. So when someone has a profound understanding, but they're not emotionally mature enough, they haven't had the right life experiences, etc., to put this into context, there is a risk of not actually being able to heal from that experience. I'll give you some examples. Personally, I couldn't connect with patients with PTSD until I had my own traumatic experience. And I'm like, oh, wow, that is maybe just a flavor of what some of my patients have experienced. I didn't know what medical gaslighting was until a close friend of mine, a doctor, gaslit myself and a family member multiple times in series. That is the maturity that you get. It's bitter and it hurts, but that is the experience that now lets your knowledge be turned into wisdom. I didn't know what anxiety was until I was a resident and experienced anxiety for the first time. Thank goodness I've healed from it. But that is when I was able to apply what various experiences I've had before and I've had since to actually help my patients to see them eye to eye. I didn't know what depression was until I saw a family member go through it and nearly lose their life. The unearned wisdom that can come with any one of these deep experiences can torpedo your self-healing. How many dreams have people had that have been absolutely life-changing? You read this in history. How many emperors have led civilizations based on what they saw in a dream? And how many people have hurt themselves based on a nightmare? How many people have had a healing psychedelic experience? And how many have had a bad trip? How many have had a meditative experience that fundamentally gave them a new view of themselves, changed their self-representation? But how many have also just gone on to go deeper and deeper in negative thought loops while they sit alone, trying so hard to focus? Well, the list goes on and on. With anesthesia, you've heard my other videos before where people can wake up with PTSD after surgery, and some patients can wake up with a healing mindset after surgery. So the cautions of unearned wisdom are so real, and this is not a new phenomenon at all, but I see it a lot when people are being pushed psychedelics. And I do always caution that when one is looking for one of these altered states of consciousness to fundamentally unlock your healing through profound neuroplasticity, allowing you to see new possibilities that weren't accessible before, there are risks as well. And one needs to be mindful and not just follow a fad. But that being said, I so appreciate all of your comments here. I want to start answering your questions. Do remember that you can always join our private Zooms at the Medical Secrets Exclusive Access, and you can always visit me in San Francisco in my clinic. But let's get started with your questions. Murray Griffin says, our bodies do amazing things. Absolutely correct. And they often do them without medications once the body's primed to heal itself. Jessica, good to see you as well. And Vic, hello back from California. Key May, if I dislike my doctor to the highest extent, if I feel bullied, gaslighted, threatened, and treated like a 2-year-old, but the insurance is only allowing for this doctor, should I allow him surgery? Well, Kimi, that's a tough question. I'm really sorry that you had that experience. And I have several videos on what to do in such situations. I don't know exactly what you're going through. I suspect it's really challenging, but have you tried calling your insurance to explain the situation? Because if there is a tremendous amount of distrust with a person in a position of power who might cause harm or healing to your body, your mindset and your expectations before that potential for harm or healing happen will play a powerful role in what ends up happening. Jen is having surgery in a week. I'm nervous about waking up from general anesthesia. I tend to freak out. Any tips for more gentle experiences? Yes, hold the mask yourself. Ask to listen to a healing mantra or positive affirmations with headphones before you fall asleep. You can watch my videos on all sorts of nutritional information, not medical advice, but nutritional information. You always need to talk to your doctor about the supplements that might be helpful for you before and after surgery. But also, do you know who your anesthesiologist is? Have you met with them before? If you have medical PTSD, has that been addressed? These are all the things, Jen, that I hope you feel empowered to explore before your surgery. Can humans go without REM sleep? I don't dream for several years. Do suffer PTSD and get flashbacks or night terrors. Well, Bumblebee, I'm sorry that you've had that. Human beings will go into REM sleep, but do we remember our dreams is a different story. Often medications will disrupt REM sleep, talking about THC, SSRIs, SNRIs, TCAs. Nearly all psychoactive medications have a degree of altering REM sleep that might prevent us from remembering our dreams, even though we are in REM sleep. Does anyone miss a period after surgery? Yes, we can because of the stress of surgery and anesthesia. Marielle, why does ketamine damage the bladder? That is a very good question. We are not fully clear on that. It certainly can happen when used unscrupulously. We see it in the recreational drug community, not in medically supervised settings, as far as I know. Psychoactives can help, but it is on the fringe. You need a guide. John, yes, that's what we're talking about. The cautions of unearned wisdom are just one of the things that we need to be mindful of when we're going on a psychedelic experience for healing. What is my take on ibogaine? Well, lava demon, that's a tough one because ibogaine is not legal in the United States and is very, very potent. Is not for the faint of heart and has very limited evidence behind it, but certainly anecdotally it can be very profound. But I do not use that because it is not legal in the United States. Sincat says, I either have good dreams or no dreams while I'm under anesthesia. It's very good sleep for me. That's fantastic to hear. And that also probably depends on your mindset. Boz Noble, where do the hallucinations of sleep paralysis come from? I don't know where the hallucinations come from. If it's like any other altered state of consciousness, it is often incepted in some ways from past memories because we know that our past thoughts can come up, whether it's in the dream state, in a meditative state, under anesthesia, etc. So it's likely somewhere deep in the subconscious or maybe even closer to the subconscious that can reveal itself in these altered states. Hey, Nikki Poe, thank you so much for the kind super thanks. That's very, very nice of you. The stars and planets are aligned, says Lava. How so? Plant medicine teaches us that we are not plants. So what are we? Well, we're not plants, but gosh, you can look at the phyla and the different kingdoms, and animal kingdoms different than the plant kingdom, land down under, mate. So I'm not too sure what you mean by that, but very interesting thought. Elliot Polak, do you think ketamine will ever become one of the gold standards first-line treatments for patients presenting to the psychiatric hospital with suicidal ideation as a result of major depressive disorder? Elliot, very good question. I don't know the answer to that. It is so effective, but it is so iffy in terms of how it is used. So until in the United States, the insurance system acknowledges holistic care, I don't think that something as potent as ketamine will ever become a first-line therapy because for it to be that effective requires a holistic view. 2 more questions. Do I work with kids? Rarely. And Bumblebee, last question. Is ketamine permitted in the UK for PTSD or other mental health conditions? And if so, how can you get access? I don't know, Bumblebee. I practice in the California, in the San Francisco Bay Area. I don't know what the rules in the UK are, but I certainly have used that medication for patients with PTSD in a mindful, conscientious, and collaborative setting, especially when other medications have failed. It's not meant to be a first line. It's meant to be in recognition of the vast potential of our healing potential to heal ourselves, especially when traditional pharmaceuticals, built with lots of side effects often, have not proven beneficial. And you can't address these deep-seated concerns without looking at the patient as a whole, which is why any of these altered states of consciousness must be regarded with great sanctity and respect, and you have to look at the human being as a whole. The patient is not just a chart or a piece of paper with a bunch of words. It's a human being with real-life experiences, and if you can't acknowledge those, how can you help guide them when they're at their most vulnerable state with you, either in the operating room or in your clinic or wherever you're having your experience? So I hope that you feel more empowered to advocate for yourself and to recognize just how much power you have over your healing. It's probably more than you've ever been told. Until next time,